Good afternoon, everyone. I, Mamta Bhatia, welcome all the participants here on behalf of Dr. Sanjay Modi. We will begin out our webinar on Genus Epidemicus shortly. A few guidelines before we begin the webinar. Kindly be muted at all times during the webinar. During the course of webinar, if you have any questions, put them in the chat box. We will have a separate question and answer session for you all at the end of the webinar where you can unmute yourself and put your questions to Dr. Modi. And lastly, I would like to say, through this webinar, we attempt to develop clarity of thought and self-confidence in practicing homeopathy with ease, because in that lies your conviction to act. Having said this, I will invite Dr. Sanjay Modi to commence the webinar. Over to you, Dr. Sanjay.
Thank you, Mamta, and welcome all. Well, thank you all for joining in. And today I'm going to, talk on my study of arsenic album and camphor in COVID-19 pandemic as a prophylactic. It is a randomized trial that had been done during this pandemic time. So there are certain observations that I have made regarding the subject itself, the subject of prophylactic, which I want to share with all of you. And a request that, let's have a contract. You understand what a contract is? A contract is a binding. So you need to give a binding to yourself that, you are going to be there till I complete. It is in your interest only. So if you have given a binding to me and to yourself, let's start off. So I have authored 2 books, Accurate Homeopathy and Organon of Medicine Simplified. And before we begin, a small tribute to our master, who has given us a very beautiful understanding about, being an unprejudiced observer, who is well aware of the transcendental speculations. And I think if the whole organon, is to be summarized, then this happens to be the most important statement that Dr. Hahnemann has asked homeopaths to observe, and that also an unprejudiced observer. It is very essential because we'll see the study that we are going to talk about is going to need all of us to be in that unprejudiced state. This was a presentation that I gave to LMHI Global Colloquium. The same topic is arsenic album and camphor for COVID-19 pandemic as a prophylactic. Now, the general talk that we always hear about is, the difference between a vaccine and Genus Epidemicus. And we are, we generally are interested in comparing the two. So I put up a little comparison here. Vaccines for the preparation needs organism, and they have to be identified and isolated. We saw that in COVID-19 too. It took a little time for us to prepare the COVID-19 vaccines because the organisms were to be isolated and identified. And India was, the fastest to probably get to manufacturing COVID-19 vaccine. That also was a very good, a step from the side of Indian government. Whereas a Genus Epidemicus, we need not isolate the organism because we don't work on the principle of treating the disease. So generally for us, it doesn't matter what the name of the disease is. We still can, employ our medicines. One of the very important factors that needs for a vaccine is the preservation and the transportation. And that also we, witnessed in COVID-19 times, because everything was shut down and transportation these vaccines had to be specially transported, and they had to be preserved also. So, the preservation as well as transportation happens to be absolutely necessary in case of vaccines. But in case of Genus Epidemicus, we need to take care of that particular. Age differences, we also saw adult vaccines came up much earlier than what the children vaccines came around, because the vaccines were different, the doses were different. So vaccines differ as far as the age is all concerned. But as far as Genus Epidemicus was concerned, we saw that, the medicine was the same, the dosage was just differed by Ayush. So we'll see what was the dosage that they had asked us to follow. In administering, either you can give it oral, like your oral OPVs, the oral polio vaccines, or you can inject it. So generally, this was also an injectable thing. And as far as, Genus Epidemicus is concerned, we find that it's very easy to take on. There are contraindications when you give vaccines, and it is contraindicated in pregnancy, immunocompromised patients, allergy, those who are on certain medications. Whereas there is no such contraindication of Genus Epidemicus. Bad effects, yes, vaccines have a lot of side effects, and we saw a lot of people talking about. In fact, just a recent video of the researcher who researched on mRNA was talking about the side effects and the bad effects of that mRNA vaccines itself. Whereas as far as Genus is concerned, so-called, it's very safe. Vaccines generally work on, acquired immunity. So they generate an acquired immunity as far as those organisms are concerned. Whereas Genus Epidemicus is said to work on at a cellular immunity level. And there are studies which have been done where, we find that macrophages, T cell level, B cell level in vitro definitely showed changes when arsenic itself was introduced in certain cells. So we'll see that also to come around. But the important aspect, and I feel that's the very important aspect, is an informed consent, which is a necessary requirement for vaccines as well as for Genus Epidemicus. Now, why do I say that it is a very necessary requirement? Is because we have to understand that informed consent is a principle in medical ethics and medical law, that the patient should have sufficient information before making their own free decisions about their medical care. In a healthcare setting, the process of informed consent includes person's ability to make a decision, explanation of information needed to make that decision. Person is made to understand the medical information that is there, and person's voluntary decision to get the treatment. An informed consent agreement should include the following information. Now, this is very important for all of us. We need to understand that whenever an informed consent agreement is being done, the patient has been informed about the diagnosis, the name and the purpose of treatment, the benefits, the risks, and alternative procedures, and the benefits and the risks of each alternative procedure also has to be informed. Now, as far as the risk and the discomforts are concerned, it has to be a description of any reasonably foreseeable risks or discomforts to the subject. Because the informed consent process must describe the reasonably foreseeable risks or discomforts to the subject. This includes risks or discomforts of tests, intervention, procedures required by the protocol, including standard medical procedures, exams and examinations and tests, especially those that carry significant risk of morbidity and mortality. Now, possible risks or discomforts due to changes to a subject's medical care, example by changing the subject's stable medication regime or by randomizing to placebo should also be addressed. Now, this is as far as, the website guidance of FDA is concerned. So I have put the site link. The benefits. This I feel is very important as far as, the part of genus epidemic is concerned, because a description of any benefit to the subject or to others which may reasonably be expected from the treatment. The description of potential benefits should be clear, balanced, and based on reliable information to the extent that such information is available. This element requires a description of the potential benefits to the subject. For example, this product is intended to decrease XXX. However, we cannot guarantee you it will benefit. But overallly optimistic representations of the treatment may be misleading and may violate FDA regulations. So here we have to be very clear about that when we are talking about genus epidemicus, we have to have a very clear, balanced, and reliable information. So informed consent is important because it requires a physician also to be well informed about the subject. Are you getting to the point? That it is very important that we get informed of the subject also. And this is my whole attempt here to give a total information that I have found available as far as genus epidemicus is concerned. Informed consent also, includes alternative procedures or treatments and its benefits, and a disclosure of appropriate alternative procedures or courses of treatment, if any, that might be advantageous to the subject. To enable an informed decision about taking treatment, consent forms must disclose appropriate alternatives to entering this treatment and their benefits. And the source I have been telling you is from, the FDA government regulations that are there. They are all regulatory information bodies which, take care of the problem. And we had seen in this, genus epidemicus time of the pandemic time, there was a homeopath who was, booked by FDA for over proclaiming about the benefits of homeopathic treatment. I like this statement very much, and I would want that, we should start working on this particular, what do I say? Motivative stand that we need to take. If the grass looks greener on the other side, stop comparing, stop complaining, stop blaming, stop demeaning. Start watering the grass you standing on. This is a very powerful statement, which I feel that we need to start off, watering the grass that we are standing on. Because whenever I put a question, is homeopathic scientific? The answer is yes, homeopathy is scientific. And when I ask the reason, for why homeopathy is scientific, the general answer is, we are based on a scientific principle. Our law is scientific. The law of similars is scientific. Now, we are all happy working out of our beliefs. But is scientific law only thing required in making of a science? Is a question that we need to address. Because for that, we need to know the difference between science and religion. Science is said to be an open belief system where the data is collected, tested, criticized, and fact-based. It is fact-based system. Whereas religion is a closed-based system where the knowledge is sacred, accepted as is, can't be challenged, and it is opinion-based. So it is very important that when we are, talking about anything in homeopathy also, we start paying attention to whether it is a fact-based talk or an opinion-based talk that somebody is talking to us about. So to introduce my subject, homeopathy became one of the mainstream branch of medicine where the general population had hope for help during current COVID-19 pandemic. We all knew that. Homeopathy was in the limelight during COVID-19 when Ayush claimed that arsenic album 30 will work as a safeguard to health from COVID-19 when the directives were followed. But a similar claim came from Shankaran in the media for using camphor 1M as a safeguard. Now, both the references of, their claims is I have put it in the later part of in the last part of the slides. Now, this created conflict and doubt in the minds of people and homeopathic practitioners as well. Hence, it was necessary to affirm the same without prejudice, the role of arsenic album and or camphor as a preventive for COVID-19 in healthy subjects. The best way to achieve this objective was by conducting a randomized control trial to determine the effect of so-called Genus Epidemicus against a control of placebo during the ongoing pandemic. Now, the study holds absolute relevance because of the time frame in which it was done. It was between June 2020 to December 2020, which coincided with the first phase of COVID-19 wave when India reported maximum cases in September 2020 at that time. So we all, if you go back again to our past, we all understand that there was a time when, in March, April, it was just, there was just a talk that was coming around about COVID-19. And then by June, everything came down to a standstill. May, it was a standstill. And then it continued in June also. But September was the time when, it was at its peak. So our study has a very much relevance because it was between June 2020 to December 2020. Now we had given placebo to 356 subjects. We had given arsenic album to 353 subjects. And we had also intended to give, camphor to more than around 350 subjects also. But unfortunately, we landed up giving only 184 patients because, I'll tell you what was the reason. What happened was when we talk about the process part of it. And the eligibility criteria were, we had the inclusion criteria where age, we included all the age, and adult, that were more than around 18 years were around 719 subjects. And children below 18 years were 148 subjects. And around, 3 subjects, we were not able to record their ages. Gender was, equal distribution of gender was done. Male were 492 and females were around 400 females. And we had included comorbidity patients. There were around 64 patients with comorbidities. Exclusion criteria were immunocompromised patients suffering from cancer, AIDS were not included in this. And diagnosis of active psychosis or severe cognitive impairment was also not considered for the study. Methodology. Medicines were purchased from a registered homeopathic pharmacy in Mumbai in exactly the way they had to be distributed to avoid any personal bias. To maintain the blinding, the bottles were coded as 1, 2, 3 instead of their names by an unblinded dispenser in my clinic. So, we bought the medicine from registered pharmacy, asking them to give us different bottles, the way they were to be distributed. And then we labeled it as 1, 2, 3. Now there are 6 local volunteers appointed in 2 locations. So we identified 2 locations and, we appointed three volunteers at one location, 3 volunteers at another location. They were spread around 8 kilometers apart and they were randomly handed over those coded bottles. They weren't aware of the name of the medicines. Neither the intermediary who was there was aware about the name of the medicines. So it was the doctor, then there was an intermediary, and there were 3 other volunteers that were there. Now, in one of the locations, the 6th volunteer that was there who had been given camphor, actually did not maintain the records well. So, we had to remove that particular thing. That's why I said that we did attempt to give around 350 patients camphor, but the sixth volunteer at the second location, did not maintain the records very clearly. Otherwise, we have all the data for those other around 900 subjects. This homeopathic medicines were advised to be distributed randomly to the subjects in close vicinity of the location identified after explaining the objective of the study, taking the subject's assent or consent, documenting their demographic data and coexisting medical condition. This is where the sixth volunteer, lapsed around, and we could not access because we were also not seeing them daily, so it's only after when we asked them to give the report, the whole data, that's where then the sixth one said. So by the time the study had already come to an end. Now the subjects were advised to follow Ayush protocol for administering medicine. The dosage was 4 pills of size 30 by adults and 2 pills by children. That is what we talked around when we talked about Genus Epidemicus, that the medicine remained the same, only the dosage was variant as far as Ayush was concerned. And it was to be taken on empty stomach for 3 days. And the dose was advised to be repeated after 1 month, same way. The subjects were also advised to follow Ayush COVID protocol of maintaining social distancing, wearing masks, and frequent head wash. And Ayush also has in their site asked that this protocol has to be followed. So the subjects were advised to report to government centers after reporting to local volunteers, because we are not supposed to treat COVID-19 cases. So, we just had to record the data. And if they experience any symptom resembling COVID-19, namely loss of taste, smell, body ache, fever, fatigue, cough, and cold symptoms, then they were to, report to the local volunteers and then go to the government centers. Now, they were closely monitored by the volunteers because they resided at the same location till December 2020 for any side effects and or active symptoms of COVID-19. These were the results. On statistical analysis, one can see that the gender category group shows that the male population in all the three, from placebo, arsenic album, and camphor, comes to around 52.2%, 58%, and 55.4%. And the female population in all the three groups of placebo, arsenic album, and camphor comes to around 47.8, 42, and 44.6 respectively. So the proportion of male and female across placebo, arsalb, and camphor are equal because groups are comparable with respective genders. And in the age category group, we find that less than 18 years, placebo had 19.7%, whereas arsenic album had 10.5% and camphor had 24%. So the proportion of children that is less than 18 years is significantly lower in arsenic album compared to placebo and camphor group. And as far as the comorbidity group was concerned, we find that placebo has around 10.7% of population who had comorbidity. In arsenic album, it was 3.4% of people who had comorbidity. And in camphor, they had 7.6% of people who had comorbidity. So the proportion of comorbidity is significantly higher in placebo group as compared to arsenic album and camphor group. So placebo group had a higher comorbidity chances. As far as arsenic had the least of all the three of them. And in the COVID-19 status group, the comorbidity we find as regards to the status of COVID-19, we find that the percentage of subjects who had COVID-19 were 0.6% in placebo, 0.6% in arsenic album, and 0.5% in camphor. Now, the proportion of COVID-19 positive cases across all three groups are near about the same. There is an insignificant difference, and that observed difference is by chance of around 0.1%. So to sum up, statistical analysis were done by chi-square test. Now, this is a repeated test that most researchers follow. So we also took the help of that only. And whatever you are seeing there is a chi-square report itself. Group 1 had age group between 1 to 80 years, where 38 subjects had comorbidity. However, only 2 subjects reported with COVID-19, and both subjects had no comorbidity. Whereas in group 2 had age group between 2 to 81 years and 12 subjects had comorbidity. We already looked through that, the amount of comorbidity subjects in arsenic album was less as compared to placebo, which is group 1. However, only 2 subjects reported with COVID-19. 1 subject had diabetes and hypertension as a coexisting medical condition, and 1 had no comorbidity. In group 3, the age group was between 8 months to 80 years. So you can see the age group is nearly the same in all the 3 of the groups, and 14 subjects had comorbidity, which also is relatively less as far as placebo is concerned. However, only 1 subject reported with COVID-19, and the subject had no comorbidity. So on subsequent follow-up in July 2021, there were no more new COVID-19 cases reported. So now we come to the analysis of the So we reviewed some existing literature, and we found that, there was one, I have already quoted the references of from where I have picked up all these things. So historically, homeopathy gained prominence following its usefulness for the management of epidemics of cholera, typhoid, yellow fever, diphtheria, Spanish influenza, Spanish flu, leptospirosis, scarlet fever, etc. There was a study which was done by Parekh, who says that use of homeopathic medicine showed promising effects in prevention of COVID-19 infection in clinical settings. But controlled randomized trials needs to be conducted to confirm the findings. There was a study done by Mukherjee to establish role of homeopathic remedies as prophylaxis to COVID-19 with Bryonia, Gelsemium, phosphorus, and placebo, concluded it to be inconclusive. This is what I was trying to make you, understand at that point of time, that, we find that Genus Epidemicus or arsenic album worked at a cellular level, because laboratory studies found that arsenic album is shown to decrease IL-6 production in laboratory model. And this was one of the important factors for which arsenic album was selected by Ayush, which is an important inflammatory marker and responsible for the inflammatory process and inducing cytokine storm. Decreased production prevents the damage of human body from such severe inflammatory responses. Another study done by Dalboni, conducted the experiment on macrophages, cell lines, using high dilutions of R-salb, 200C potencies, and it showed a decrease in IL-6 production in macrophages. There was another study which was done on T and B lymphocytes, and the essential components of cellular and humoral immunity showed that they were all affected by arsenic. The activation of leukocytes leads to differentiation of CD4 plus T helper cells and CD8 plus T cytotoxic cells. And a decreased percentage of CD4 cells and altered CD4-CD8 ratio has been observed from chronic arsenic exposure, requiring clinical trials for confirmation. So these are all the lab studies that were done. So we come to the discussion part. Based on the RCT results, following conclusions can be drawn. The study was only to estimate the efficacy of so-called Genus Epidemicus as a safeguard from developing COVID-19 disease. This was the only purpose for which I did the study. There were no observable side effects reported by the subjects during the study. One of the important factors that needs to be considered when giving prophylactic medicines to healthy population is how much of those healthy persons got exposed to the infective disease agent. Because according to WHO, case investigation and contact tracing guidance, it is recommended that people be considered contacts if they had contact with an infected person from 2 days before the infected person developed symptoms. So when we are doing a study on a prophylactic, it is very important as to how many of the healthy person had got exposed to the infective disease agent. Because if they have not got exposed to the infective disease agent, there are no chances of them getting into any disease state. Now, there are two terms that refer to contacts also who do not have symptoms. The difference is that asymptomatic refers to people who are infected but never develop any symptoms. And we know at this point of time also there are many asymptomatics who are moving around, who don't have any symptoms, but who are infected people. And how to identify that? It's not possible to identify them. While pre-symptomatic refers to infected people who have not yet developed symptoms, but are going to develop symptoms later, because there is going to be an incubation period that is going to be there for some time with any infection, you know, and it, it may come up in 5, 7, 8 days also. But those are pre-symptomatic patients who have been infected and have not developed but are going to develop symptoms. Now, we cannot neglect this data when we are referring to the role of prophylactics. Are you getting the importance of this understanding? The other thing is, you know, the in vitro versus the in vivo aspect of it, because arsenic album, though in laboratory study showed response to T cell, but in human body, it showed no definite protective power towards COVID-19. And that is why I say Hahnemann's insistence of recording effects of substances that is proving on a healthy human body seems to be very scientific. Hahnemann was very clear about it at that point of time, that unless and until, you know, we have recordings done on human body, that only will be very reliable. And here we can see the difference that, you know, laboratory study showed definite responses. But as far as, you know, clinical trials were concerned, it failed to show an effect. The fourth point is this, that the role of natural immunity and precautionary measures undertaken by the subjects can guard the healthy persons from getting infected. We all know that particular thing. That, you know, it was very important that natural immunity and precautionary measures that were undertaken saved a lot of healthy persons from getting infected. And here, especially when this study finds that arsenic album 30 or camphor 1M made no significant difference as protective for COVID-19. Since the proportion of subjects affected by COVID-19 was the same in all three groups. There were also no observable difference in the severity nor the course of the disease. In patients who suffered from COVID-19 in all the three groups, now to conclude, there are two possibilities that seem probable. Mamta ji, don't let anyone join now. So to conclude, there seems to be, you know, there are two possibilities that seem probable. We have a lot of people now joining, which actually makes no sense. I don't know why. Anyway, so firstly, the possibility is probably we have wrongly identified the genus in this pandemic. And homeopathic profession needs to, clearly define selection criteria for genus epidemicus. Because in this pandemic, we saw that the remedy that covered most symptoms in many patients was labeled as genus epidemicus. If you see the repertorial totality of, both arsenic, alba, and camphor, you'll find all the symptoms being put into that. So when most of the symptoms were being covered, and in many of the patients, that became the genus epidemicus. The genus was already, circulating even before the pandemic reached in India, if you recollect that particular thing. Now, this, according to Hahnemann, is speculative. According to Dr. Hahnemann, as per aphorism number 101 to 103, physician becomes clear of genus epidemicus only after treating several cases, because the peculiar symptoms gets more and more complete by the time. And this is a scientific approach or the way to select genus epidemicus. So firstly, there could be a possibility that we have wrongly identified the genus epidemicus. Or the second possibility is this, that, we have misunderstood and misrepresented concept of genus epidemicus. And the time has come where we need to realign ourselves with scientific evidences which are reliable. So we need to re-examine with an open mind the concept of genus epidemicus. So how do we go about? There are two roles genus epidemicus, is very useful in treating active cases. Not only to shorten the, it treats in the shortest possible time, but it also shortens the course of the disease. And here, genus epidemicus definitely saves not only time of case taking, but even saves time in selecting remedies, because then there are only few similar remedies that are to be differentiated. So that's one of the roles. First role, is to probably treat active diseases. And we have seen a lot of cases, even in COVID-19 active patients, homeopathy has helped very beautifully. There are a lot of homeopathic doctors who have treated COVID-19 cases rapidly, saving time, effort. And the second is, to use as a safeguard for healthy people. Now, the puzzle here is to select the best safeguard in absence of a symptom, because healthy patients have no symptoms. So the logic we use is that what is true of the diseased patient is true of the healthy person, because the disease we are going to treat is the same in both. So the remedy is going to be the same, right? This is the logic we use. To check the scientific validity of this logic, let us pass it through organon to see what it means. See, we have already been given a lot of logic, but we never see what it means in that particular way. So what's the catch? Firstly, we prescribe an artificial disease to a healthy person based on symptoms of other disease patients. The logic we use is what is true for disease patients is true for healthy people. Because the disease we are treating in the patients and the disease we are trying to avoid in healthy person is the same. So same remedy works. But the point missed here is that the similarity is to someone else. Are you getting to this question? As per aphorism number 17, cure is removal of the whole perceptible signs and symptoms of the disease. The internal alteration of the vital principle also simultaneously is removed. So it's not just that perceptible signs are removed and the interior alteration remains. He says by removal of the whole perceptible signs and symptoms, the internal alteration also is at the same time removed. But when the disease is annihilated, health is restored. So Hahnemann here is very clear that when you annihilate the disease, you remove the disease, health gets restored. Now it clearly reads that disease and health cannot stay together at the same time. As per aphorism number 17, then the question that comes up is, what disease will get annihilated when curing a healthy person? Are you getting it? And how will health be restored in already healthy? Otherwise, how can we explain cure, disease, and health while treating a healthy person? As per aphorism number 17, there are only two possibilities. Either aphorism 17 needs to be overruled, or treating healthy person seems illogical. Now we come to a very important and interesting aphorism which we all quote around, and that's what we talked when we started off with saying that law of similars is so scientific that it makes the whole science of homeopathy. And we all know what aphorism number 70, aphorism 26 is, that a weaker dynamic affection is permanently extinguished in the living organism by a stronger one, if the latter is very similar to the former in its manifestations. We all know this law very well. Because the similarity has to be, first of all, according to it, within the person. Then only the similarity is there. First of all, we already looked to the similarities to some other person. But interestingly, we have to understand that from a scientific standpoint, the question that now comes up is that when a person is healthy, will there be a weaker dynamic affection? Is there any weaker dynamic affection when the person is healthy? You would say, oh no, there is no weaker dynamic affection. How will he be healthy? That's precisely what my question is. That can the law of similars be still valid in absence of a weaker dynamic affection? Now, if you read, there is no weaker dynamic affection and it is permanently extinguished in a living organism by a stronger one. Does it make sense? That no weaker dynamic affection is permanently extinguished. Why we say no? We say absent weaker dynamic affection is permanently extinguished in a living organism by a stronger one, if the latter is very similar to the former in its manifestations. Similar to where? To somebody else also. Not similar to the person to whom you are giving the remedy. It's similar to some foreign person. So to what will the remedy be similar to in a healthy subject? And what will get permanently extinguished in a healthy person? Now, these are all scientific questions that needs to be answered by the profession. Because when there is no weaker dynamic affection, then what would a stronger dynamic affection do to a healthy person? Is the very valid question that comes up. That in absence of a weaker dynamic affection, what is a role that a stronger dynamic affection is going to play? Yes? And the answer lies in aphorism 32. Because it is quite otherwise with the artificial morbific agent. When we are giving a stronger dynamic affection, we are giving an artificial morbific agent, which we term medicine. Every real medicine namely acts at all times under all circumstances on every living human being and produces in him its peculiar symptoms, inoculated with the medicinal disease at all times and absolutely. That is unconditionally. And in aphorism number 108, Hahnemann very clearly says that there is no sure, no more natural way of accomplishing this object than to administer the several medicines experimentally in moderate doses to healthy person in order to ascertain what changes, that is symptoms and signs of their influence, each individual produces on the health of a body and of the mind. So according to Dr. Hahnemann, administering medicine to healthy person should cause proving of that medicine. Now, the above questions have a bearing on the scientific aspects of Genus Epidemicus, is what I say. Because when we connect all these dots, the concept of Genus Epidemicus for a healthy person stands on a questionable ground and calls for a re-examination with an open, unprejudiced mind. Are you all here? Now, WHO has the courage to back off remdesivir as FDA's issue, other as US. You know that, WHO went over that even, all the remedies that have been talked were never useful for COVID-19. And recently, we also had a video of the researcher and the maker of mRNA vaccine talking openly about side effects. That is why I said science collects the data, checks it, and puts it to, criticism. So we come to the conclusion part of it, that mirror, mirror on the wall, are we as a profession critical, analytical, truthful? Because the logic that is used to prescribe Genus Epidemicus is, Dr. Hahnemann had written in Organ Medicine. Homeopathy had success during Spanish flu epidemic. Homeopathy had success during cholera epidemic. We heard everybody talking about it at that point of time. Regarding Dr. Hahnemann's mention of using belladonna in scarlatina as preventive, let us look to what Dr. Samuel Hahnemann has to say in Cure and Prevention of Scarlet Fever, available in lesser writings. So what I'm going to do is I'm going to quote what Hahnemann has written in lesser writing. So writes Hahnemann, the mother of a large family at the commencement of July 1799, when the fever was most prevalent and fatal, had gone to buy a new counterpane, whose child was having scarlet fever. Now the mother received the counterpane, it smelled it to be sure that it contained no bad odors. she laid that on a sofa pillow and took a nap on the same in the same afternoon on the same pillow. A week later, she became ill with the sore throat. Her daughter, 10 years old, soon after manifested marked symptoms of scarlet fever. Hahnemann, judging from her symptoms, say, my memory and my written collection of the peculiar effects of some medicine furnished me with no remedy so capable of producing a counterpart of the symptoms here present as belladonna. So, when the daughter got fever, what Hahnemann is trying to tell is this, that he chose on belladonna as the remedy. And application of the new law, a valuable preventive was discovered. He gave her 1,432,000 part of a grain of belladonna, with the result that in about 24 hours she became well. He writes, I reasoned thus that a remedy that is capable of quickly checking a disease in its onset must be its best preventive. And the following occurrence strengthened me in the correctness of this conclusion. So that was one instance where he, used belladonna in one of the patients and the child got recovered in 24 hours. But he also had, a simultaneous, an occurrence that happened where some weeks previously, 3 children of another family lay ill of a very bad scarlet fever. The eldest daughter alone, who up to that period had been taking belladonna internally for any external affection of the joints of her fingers, to my great astonishment, did not catch the fever. Although during the prevalence of other epidemics, she had always been the first to take them. So when these two instances were connected, Hahnemann said that in that family where, the girl had fever, he gave it to 5 other children. He gave next day the remedy to other 5 children who all remained perfectly well amid the most virulent scarlatina emanations from their sister. In the meantime, I was called in to attend to another family where the eldest son was ill of scarlet fever. But I wished to keep the other 3 children free from this malignant disease. One was 9 months, another 2 years, and the third was 4 years. And I had the happiness to preserve these 3 children free from the pestilential disease. Now, this is the only thing that Hahnemann writes about preventive of for scarlet fever. Belladonna is preventive for scarlet fever. Now, if we see the literature, as per Center for Disease Control and Prevention, it is most common, meaning scarlet fever is most common in children between 5 years through 15 years. It is rare in children younger than 3 years old. So now 2 kids here were 9 months and 2 years. So in all probability, there is a chances that probably they would belong to this rarer condition than probably what Hahnemann talked around. Because Hahnemann also gave a very important, write-up in prevention of epidemics in towns in lesser writing, where Hahnemann says that they may or indeed ought to follow the mode of life of healthy individual and keep their usual drinks, food, and ordinary recreations and exercise in the open air. But they must take care to avoid excess in any of these things. Hahnemann was talking about how to prevent epidemics. And he says infectious diseases have been communicated by money, letters. Acquaintances kiss each other or shake hands. This ceremony should be omitted when the danger is so imminent. Also, drinking from another's glass should not be done. Domestic animals that are given to move, such as dogs and cats, often carry about them in their hair the virus of infectious diseases. For security's sake, advisable to get rid of them at such times. And he gives a list of all other things that everyone has to do. So when we look at the above example, from a scientific perspective, we need to answer some questions. There is no reference of the immunity status of these children available. Now, also knowing Hahnemann's in-depth understanding of prevention of epidemics, he would have asked patients to take all precautionary measures. And we know its importance in preventing spreading of infections. Now, Hahnemann's in-depth understanding, why I'm saying in-depth is, if you read the article that Hahnemann has written, beyond understanding, meaning beyond comparison. He has talked about what a rag picker has to be, how he has to be taken care of by the society, how prisoners have to be taken care of by society, what has to be done when a prisoner moves out of the care, out of the prison, how prisons have to be all made clean. He has talked about how schools, how churches, how hospitals have to manage. The best part is he has even mentioned about how to take care of the dead body of a person who died because of that infectious disease. Now, that much amount of in-depth understanding Hahnemann has, and Hahnemann has asked his patients to take care of all those precautionary measures. And we saw also this particular thing, that there is a possibility that this also could have accounted to Hahnemann's understanding. Because how much relevance are some 3, 4, 5 instances? The profession needs to have a solid statistical data. Also, what was the infectivity? Because modern, understanding needs to know the ability of an infectious agent to cause infection, which is measured as a proportion of persons exposed to the infectious agent who became infected. For COVID-19, for example, study finds that the disease transmission rate from close contact roughly decreases in line with the number of close contacts, with median coming to 0.13. And the average secondary cases were 2.10, 1.35, and 2.2 for the first, second, and third generations. So progressively, they find that there is a decrease in the transmission rates in close contacts. So to conclude, according to me, in absence of other important data, just to give credit to one factor is risky. There are recent studies which, papers which have been put across by researchers, like in this case, I found this a beautiful paper by Lin Zhang, which says, characterizing COVID-19 transmission. Now, he has identified factors that help or probably stop COVID-19 transmission. And in that, he has put across incubation period, reproduction rate, multiple generating spread. I'll talk about what that means now. So, now considering the incubation period, he says a shorter incubation period of 4.2 days, inferring that COVID-19 is more infectious. So the more shorter the incubation period, the more infectious the disease becomes. And he has identified, he has talked about all the cases that are there. I'm not going to go into all those things. There is a lot of meta-analysis that he has talked around the mean median days of 5.8 to 5.1 days. I want to just put across to the homeopathic profession that there are a lot of factors that needs to be considered before just putting across that, we are able to prevent a particular problem. The transmission rate. So the first is the incubation period. Then he talks about the transmission rate. Is defined as a probability that an infection occurs among susceptible people within a specific group. It is an important index for providing an indication of how social interactions are related to transmission risks. And here, they based on the number of reports that were there, he showed that the rate is of 35%. The transmission rate in COVID-19 was 35%. Caused by different contact methods. One of the most other important indices for infectious disease is the basic reproductive number. And then he goes on to identify the number of studies to show how fast the virus was reproducing. And then he says that, the effective reproduction number is changing with time. It's changed from 2.35 to 1.05 due to lockdown in Wuhan within 1 week. And then he comes to the fourth point, and the best known model within infectious disease epidemiology is the SAIR. So SAIR says it is susceptible, exposed, infectious, and recovered model. And these models are utilized for general population level to understand, how much is the strategic decision or effectiveness of mitigation measures are taking place. And he finds that, the sub-exponential growth of COVID-19 was because the containment was very effective. in China as well as in Italy, based on this SEIR model. So just to give you an example, the effectiveness of the virus dependent on a lot of criteria. We need to consider all those things also. Now, in another study, Belford's account of his trial must rate as one of the most succinct and careful accounts of a clinical experiment ever written. There were 151 boys of whom I had tolerably satisfactory evidence that they did not have scarlatina. I divided them in two sections, taking them alternately from the list to prevent the imputation of selection. To the first section, 76, I gave belladonna. To the second, 75, I gave none. The result was that 2 in each section were attacked by the disease. The numbers are too small to justify deductions as to a prophylactic power of belladonna. But the observation is good because it shows how apt we are to be misled by imperfect observation. Had I given remedy to all the boys, so had belladonna been given to all the boys, I should have probably attributed it to the cessation of epidemic. It is very easy to comment saying so that 151 boys are only 4 boys got scarlatina. Now compare Belford's account against Hahnemann's account. Hahnemann's observation is correct, but his conclusion seems to be inappropriate. I have other instances where Hahnemann's observation also, was very correct, but the conclusion today stands invalidated. What is it? Maybe we'll talk about next time. What am I referring to? See, homeopathy in the rescue of 1918 Spanish flu. Now, that Belford's study also was done, and it is a paper that has been put across. So I have given the reference of this paper. So Belfort was said to be a person who I think was the initial person who has done, the basics of, could be pioneerings of researches, how to research. And he did, one of them was this. So we had some other research paper that was presented by Dr. Shinde, which, talks about homeopathy in the rescue of 1918 Spanish flu. And the homeopathic physicians were treating patients of Spanish flu with a marked success rate. Now, this is what I want to still point out to the profession, that it's a very clear statement that the homeopathic physicians were treating patients of Spanish flu with a marked success rate. Dean W.A. Pearson of Philadelphia collected data of 26,000 cases of influenza treated by homeopathic physicians with a mortality rate of 1.05%, while the average mortality rate treated by conventional medicine was 30%. I agree to that particular thing. Mortality rate of Spanish flu patients treated by homeopathic physicians was possibly 1/3 less than those treated by other physicians. And parallel group of cases everywhere shows a homeopathic mortality of almost negligible when compared with other systems of therapy. Now, Dr. Shinde gives a list of, from where the data has come around. And you could see, Dr. Miller, they had a quota of influenza and had not heard of a death under homeopathic treatment. One of the severest cases who developed pneumonia with influenza was recovered. Dr. Henderson, during service at Hahnemann's hospital, no case came during under treatment, early was fatal. Remedies were selected. Then A. Blackwood says, given a well-ventilated room, good general care, and 75 to 80% require nothing but, or for pulmonary involvement, sanguinaria. They reported no pneumonia, no fatalities in patients seen in early stage. Now you can see all those things are referring to what? Now, some other reference work which one can find even in the net is about the epidemics, and they said that when cholera finally struck Europe in 1831, the mortality rate under conventional treatment was 40%. To Osler's practices, so it was between 40 to 80%. Out of 5 people who contracted cholera, see here it's very important. Out of 5 people who contracted cholera, 2 to 4 of them died under regular treatment. Dr. Quinn in London reported the mortality in 10 homeopathic hospitals in 1831 to 32 as 9%. Dr. Roth, physician to the King of Bavaria, reported that under homeopathic care, the mortality was 7%. Admiral Monroe of Imperial Russian Council reported 10% mortality under homeopathy. And Dr. Wild, that is an allopathic editor of Dublin quarterly journal reported in Austria, the allopathic mortality was 66 and the homeopathic mortality was 33%. Now, the above studies refer to treating Spanish flu cholera disease. They were of patients who were treated with homeopathy with low mortality rate. This is different from the understanding when given about homeopathic remedies being used as a preventive in Spanish flu and cholera. Are you understanding? That's why I made a very clear chart of it, that as far as disease patients is concerned and healthy patients is concerned, this is all talking about disease patients. And it is like treating COVID-19 cases. And homeopathy helps in active disease by any name. And I agree on that particular thing. So let us be clear what we convey when we say preventive. Preventing disease patients from getting more ill, preventing patients from further complications, or preventing healthy persons from getting diseased. My inference, Genus Epidemicus in patients. So when it is given to patients, as per aphorism number 101 to 103, has a definite role to play. But when it is given to a healthy person, I equate to a Chinese whisper. You all know what a Chinese whisper is. Started with Hanuman and the whisper grew up. And I say it has no role to play. That is my inference. I, leave you or end you probably with a small puzzle. So what's the puzzle? So let me take a similar example. What are the symptoms when somebody falls? So somebody who gets injured, what are the symptoms? Usually all injured patients complain of soreness and bruise, right? Now, when we look into the materia medica, what medicine comes in most instances? Arnica. So using the same logic, Arnica is the genus epidemicus for injury. Yes. Hello. Arnica is the most commonest remedy that is prescribed in most patients who get injured. So, Arnica should be the genus epidemicus for injury. Now, using the same corollary that we use for genus epidemicus, we can give Arnica to healthy persons. So when they fall, they will not have any soreness and bruise. Would you believe this? Will it work practically? It's my question. I want to ask you that. Would you believe this? Then now I take Arnica and then I have a fall and, nothing will happen. And will it work that way? Now, example might seem far-fetched in minds of some, but the process of selection is the same in both instances. The genus epidemicus, the way we are selecting and trying to prevent a problem, and the genus epidemicus here, the way it is the same. So my message is every science has a limitation, and the best way is to accept it and improve on its assets so that humanity benefits. Time is right to do SWOT analysis and work on strengths and opportunities in homeopathy, then our weakness and threats as a system. Strengthening our strengths and opportunities and weakening our weaknesses and threats require awareness and acceptance. Being honest will only be valuable. So it's best to be realistic now and face an unpleasant truth as soon as possible. Homeopathy as a medical branch has tremendous potential in treating many diseases, acute and chronic. I have treated a lot of cases, and I tell you, the success rate and the success story of homeopathic patients is too good. There are a lot of other doctors who also, who have treated grave pathological cases. So there are a lot of pathological cases that have been treated day in and day out with homeopathy. And that's our strength. We work on our strength. And let us be open enough to work gracefully with other systems of medicine rather than viewing them as competitors in the interest of our patients, and build a real complementary system to benefit suffering mankind. What is a SWOT analysis? Actually, SWOT analysis says that every system within itself has its own strength and its own weaknesses. And that is within the system. And till some extent, you can increase your strengths also to some extent. And to some extent, you can reduce your weakness also, but there will be an inherent weakness. And there will be an inherent strength. It's like, if I look to probably, maybe becoming a cricket player, but I don't have a strength of playing cricket. If that's my weakness, I will not be able to become Sachin Tendulkar at any point of time, because that's my weakness. Weaknesses cannot be changed into strength. They can be modified to some extent, but the earlier we accept our weakness and the strength and we realize it's better. Opportunities and threats, they are all external. So we need to identify what our strengths are, what our weaknesses are, what our opportunities are, and what our threats are. To end, I would like to point out to you what Hahnemann talked around in aphorism, footnote to aphorism number 1. He says his mission is not, however, to construct so-called systems by interweaving empty speculations and hypotheses, nor is it an attempt to give countless explanations wrapped in unintelligible words and an inflated abstract mode of expression. Of such learned reveries, we have had quite enough. And it's now high time that all who call themselves physicians should at length cease to deceive suffering mankind with mere talks. So let us stand up to Dr. Hahnemann's expectations of true physician and aim to leave a legacy of a scientific system that gives clarity, confidence, and pride in practice of homeopathy. Order supply. Now, these are the references. The first one is from Ayush guidelines that are there for homeopathic practitioners. The second one was Shankaran's hpathy.com. The third was about the, epidemic management of epidemic. And it was written by Jacobs, who says we have a lot of epidemics where homeopathy had been useful. The fourth one was Neeraj Parikh, who wrote of COVID-19 management, a clinical experience. Mukherjee, homeopathic medicines used as prophylaxis in Calcutta during COVID-19 pandemic. The arsenic album thing, it's a study which is already available by Dalboni. Then the arsenic album study of analysis of T cell proliferation and cytokine secretion by in arsenic by Biswas R. Bellimari had talked about arsenic and immune system. Leo WT has also talked about differential effects of arsenic on cutaneous and systemic immunity. This is where we get most of our understanding that we work on cellular immunity. And again, Soto made a study of cytokine secretions in children exposed to arsenic. This was the Belfour account that I'm talking of, which is a research article presented by Chalmers, the 19th century controlled trial to test whether belladonna prevents scarlet fever. It is in JR Society Medicine. And the pandemic of Spanish flu by Shinde. So these are all the references that I have pointed out to. And to end, I would love to have your feedback, either at our WhatsApp group. You can also visit me on my YouTube channel, Sanjay Modi Homeopathic Lectures. Be that change to make a difference in homeopathy. If you have any questions, I am here. You could put it across.
Participants, you all can now unmute yourselves and ask the questions to Dr. Modi.
Yeah, there is one question coming up. Tell me.
Sir, good evening.
Yeah,
Instead of giving only arsenic and camphor or the controlled trials, instead of that, whatever the patient needs, whatever his symptoms the patient gives, is that the right way or?
No, if it is a patient, then the patient symptoms guide. That's the only way, not right way or wrong way. It's the only way I feel.
Okay, sir.
It is the patient, but we are talking of healthy people. What to do? There are no symptoms.
Then they don't need medication.
Exactly, they don't need anything. Simple.
Okay, thank you, sir.
Good. Yeah, thank you. For me, symptoms are the guide to prescription. Always, always, always.
Thank you so much.
Thank you.